panel and to the distinguished guests who have made time to join us. Good afternoon, Molweni, Jambo, and Bonjour. I hope I got those ones right. This is Africa. I have to get those names right. It is my great pleasure to address you today as we collectively seek ways to build a peaceful and a progressive continent. Engagements such as these enable us to exchange best practices which help us to sharpen our interaction with our citizens. Early this year, the World Health Organization declared the COVID-19 as a global pandemic. Africa has not been spared the devastating impact of this pandemic. Health experts have already advised that to date, there is no vaccine or cure for COVID-19. President Cyril Ramaphosa, in his opening remarks as the chair of the AU, made the following remarks in the Conference of Africa's Leadership Role on COVID-19 Vaccine Development and Access. She stated that Africa has to be innovative in addressing our resource constraints through the establishment of the AU COVID-19 Response Fund, the Africa Medical Suppliers Platform, and the partnership to accelerate COVID-19 testing for the continent. She further stated that Africa should be planning and collaborating in its approach to the development and the effective distribution of the vaccine when it is found. This also challenges us to improve our communication infrastructure within the continent and improve our collaborative endeavors in the fight against health epidemics in the continent. South Africa responded at its first COVID-19 case on the 5th of March. The infected man and his wife had traveled to Italy on holiday. 2 weeks later, the country reported about 61 cases. It is also reported that 2 weeks later, we also had our first death as a result of COVID-19. To date, South Africa is leading the continent with over 600,000 cases and sadly over 12,000 deaths as a result of COVID-19. Today's topic is on the importance of leading communication as opposed to the crisis management during this period of COVID-19. After the World Health Organization had declared this pandemic, various countries adopted different responses to deal with it. South Africa also sprang into action and embarked on a comprehensive communication campaign to inform the nation about the measures to curb the spread of the virus. Among other things, basic information encouraging people in South Africa to wear a mask when in public, keeping a safe social distancing and regularly washing their hands with soap or use of an alcohol-based sanitizer was made available in all the 11 languages in South Africa. It should also be noted that many health experts agree that government had proactively flattened the curve and drastically reduced the spread of the virus by declaring the national state of disaster that resulted in a national lockdown. However, we should point out that some people felt that the government had overreacted in its response. Ladies and gentlemen, communication remains the most powerful instrument for the public interaction and engagement. In March 2020, President Cyril Ramaphosa stepped in to lead government's concerted effort to manage and reduce the clearly increasing COVID-19 cases in South Africa. In his first address to the nation, the president announced that the formation of the National Corona Command Council, which is a structure that he was to chair as he coordinated the response of the country in dealing with the COVID-19. One of the work streams that was reporting on a weekly basis through this council was the communication and the mobilization. Prior to the setting up of the structure, we should point out that the communication was solely led by the Department of Health. As the infection numbers were continually increasing, fear and panic started creeping in communities across the country, especially in the Western Cape, which was the first province to experience a peak in a number of infections and deaths. Transparency and constant communication became key tools to empower communities in understanding the virus and how to protect themselves against it. All the government communication structures were pulled together to be led at the central level under the leadership of the GCIS. A communication strategy on COVID-19 was adopted, and it served as a guiding document in the development and dissemination of COVID-19 related messages. We should also point out that the Department of Health played an important role in signing off the content which was to be used in the communication. Our key principles were to keep our messages clear, concise, consistent, and all striving to effect the behavioral change to our citizens. The platforms we are using were informed by the outcomes of our research in respect of the preferences that were to be used by the various stratas of our society. It is important to highlight that South Africa remains a developmental country, still facing various levels of inequality. These obviously presented challenges in how we effectively exploit the less expensive and effective media, such as in the technology. For instance, we still had to explore conventional ways of interacting with communities in densely populated areas with less media coverage. To maximize the coverage and the impact of our communication, we first had to acquire a better understanding and appreciation of our target audience, including their communication needs and preferences. We had to invest in research that assists us to package our content for the different segments of our population. Our research also assisted us to obtain feedback on the impact of our messaging, and also assisted us to identify the glaring gaps in how we interact with our communities. Our communication intervention was in 4 fronts. We had to depend a lot of the media on the media, which I think one has to emphasize that media in this country went beyond the call in making sure that the information educating of South African is achieved. We also invested in a paid-for advertisement, which was both in the broadcasting print media. We also invested in the face-to-face engagements, and also we invested in the digital media platforms. To date, the last research report that we received was that over 90% of South Africans know and understand the basic health protocols that needs to be adhered to. However, we are also very much aware what research tells us, that we still have some challenges in how the South Africans behave in terms of observing the protocol, health protocol as provided. We have also amplified our interventions by building considerable number of partnerships with the private sector, with community-based organizations and the faith-based organizations. We have provided them with the information packages which they've used in their various platforms. We have also invested in working with the community-based media to reach the communities across the country. In the midst of our successes that we have achieved so far, I would also like to mention some of the curveballs that we have had to contend with during this period. When President Cyril Ramaphosa announced the national state of disaster in March 2020, our economy was on a slow growth trajectory. The Statistician General had reported that the South African economy recorded its third consecutive quarter of economic decline, falling by 2% in the first quarter of 2020. This followed a contraction of -1.4 and 0.8 in the fourth quarter of 2019, respectively. Unemployment increased from 29.1% to 30.1%, and we should indicate that the majority of the people who are unemployed at the moment are young people. The long lockdown restrictions further worsened the economic hardships faced by a number of South Africans. To mitigate the impact of the COVID-19 on the economy, the government announced a 500 billion package, a social relief package and economic support to the struggling businesses and also to the poor people. Apart from the economic decline, we have also noted a lot of hardships from families who lost their jobs, and also some of them who have sadly lost their loved ones during this period as a result of the COVID-19. Unfortunately, the good work done by government was to a certain extent spoiled by reports of acts of corruption involving unscrupulous companies and individuals. We remain encouraged by the freedom of the press in our country, which has contributed greatly in exposing some of these acts of corruption. Government respects and acknowledges the role the media that plays in safeguarding our democracy. We are also encouraged by the swift intervention by the law enforcement agencies to deal decisively with corruption. Chairperson, as I conclude, it is my view that our government responded swiftly to deal accordingly with COVID-19 by imposing the national lockdown. I strongly believe that this intervention assisted in strengthening our state of readiness as we subsequently started experiencing a decrease in the rate of infections. This has resulted recently in further reopening of the economy to level 2 of the risk-adjusted strategy. Level 2 further reopens our economy and relaxes restrictions on the movement of people, particularly interprovincial traveling. Once again, government played a central role in informing the public about the revised regulations through different platforms and in all the official languages. Lastly, when the president was addressing in the last address to the nation, he reminded us by using the quote from the former president Nelson Mandela that as we move to level 2, everything will depend in our hands and us taking responsibility as the citizens, as we know that COVID-19 is not yet gone. We've just reduced the number of infections, but it is still with us. I thank you. Bye, Danki. Asante sana.